So I will be talking about extracorporeal membrane oxygenation, its broad usage, this particular medical innovation, especially after the COVID times, where it has been used on many patients and there has been a considerable amount of good outcomes. What is extracorporeal membrane oxygenation, also called as an ECMO? It is nothing but it's an artificial life support machine which has an oxygenator which helps in exchanging carbon dioxide as well as oxygen outside the body. That's why it is called as an extracorporeal membrane oxygenation machine. So it provides a temporary support to the respiration, that it takes over the part of the lungs, and also it provides a temporary support to the heart. So that's why it also provides a cardiac support. So this particular technique is usually used as a life salvaging measure or a life sustaining measure. It is never a treatment. It just acts as a bridge to recovery, and it provides support to both heart and as well as the lungs during the critical illness, especially during respiratory failure or a cardiac failure. So if you look at the previous talks, usually the ECMO has been mainly concentrated on something called as lung infection. In ECMO we have two types of ECMO. We have a veno-venous ECMO and the other one is a veno-arterial ECMO. So veno-venous is usually used for a respiratory disorder where you need the oxygenation or the carbon dioxide removal. So it is used in a respiratory failure like pneumonia, or sometimes some lung diseases called chronic obstructive lung diseases where you have carbon dioxide retention. So VA ECMO is a different category where this provides an additional support. In addition to respiratory failure, you can also treat the cardiac failure, especially in a patient who is hemodynamically unstable, when the blood pressure is very low or the cardiac function is poor. In this subset of patients, we need to go for veno-arterial ECMO. So this veno-arterial ECMO has got a broader implications and a broader usage. Nowadays, recently we are using it more often in toxicological cases, especially in overdosages of medications like calcium channel blockers or beta blockers, and recently we also have used in yellow aluminum phosphide toxicity patients. Younger patients are the ones who succumb to this kind of illness, and usually these set of patients, they will go into profound hemodynamic instability, and the medical treatment itself will not be sufficient for these patients. Irrespective of any number of higher medications support you give, the patients still go into hemodynamic instability and they usually succumb to these kind of poisoning cases. But in these particular cases, the veno-arterial ECMO becomes a boon. So in this case, what happens is, when you initiate somebody on a veno-arterial ECMO, the ECMO itself provides them a temporary cardiac and respiratory support, so that the effect of the medication wears off in the certain amount of time, in 1 or 2 days, and eventually the organ functions and the cardiac function returns back to normal and the patients will leave. So this is one of the main implications of a veno-arterial ECMO. Other than this, when the patient has a cardiac failure because of the heart attack, that is called as myocardial infarction, patient has pulmonary embolism, that is clots in major vessels of the lungs, and any other cardiac failure patients, post-cardiac surgery patients also, this ECMO has been quite helpful. This ECMO machine basically has two important components. It has got something called as a pump, which takes over the function of the heart, and it has got something called as an oxygenator, which takes over the function of the lung. So the pump drives the blood from the patient's body into the oxygenator, and from the oxygenator, the oxygen and the carbon dioxide exchange happens and it is given back to the patient's body. This provides a temporary hemodynamic as well as respiratory support to a patient who has consumed any of the toxicological substances which can provide hemodynamic as well as respiratory compromise. So the knowledge about ECMO has not been very profound, and many have been restricted to only respiratory failure. But there are a lot of cases who have recovered with the help of VA ECMO, especially the toxicological cases. So the awareness about the uses and benefits of VA ECMO needs to be more and more, so that the youngsters who succumb to these medication overdosages or any toxicological cases, they have a chance to fight the life.